doctors, this is Dr. Hira Salman. So welcome to MCQ of the day. So today we are going to solve one MCQ from cardiology, and let's start. So a 62-year-old man comes to the physician in May for a routine health maintenance examination. He feels well. He underwent a right inguinal hernia repair 6 months ago. He has hypertension and type 2 diabetes mellitus. There is no family history of serious illness. Current medications include metformin, sitagliptin, enalapril, and metoprolol. He received the zoster vaccine 1 year ago. He received the pneumococcal polysaccharide vaccine 23 valent vaccine 4 years ago. His last colonoscopy was 7 years ago and was normal. He smoked a pack of cigarettes a day for 20 years but quit 17 years ago. So he smoked a pack of cigarettes a day for 20 years. It means 20 pack years, but quit 17 years ago. He drinks 2 to 3 alcoholic beverages on weekends. He's allergic to amoxicillin. He's scheduled to visit Australia and New Zealand in 2 weeks to celebrate his 25th wedding anniversary. He appears healthy. Vital signs are within normal limits, and S4 is heard at apex. The remainder of the examination shows no abnormalities. Which of the following is the most appropriate recommendation at this time? So when we are looking at the question, the age of the patient is very important in this question. So this is 62 years old, and right now the month is May for routine health maintenance examination. In May, he just went for this examination. He overall feels well, but he has undergone this inguinal hernia repair 6 months ago. So this is an important point here. 6 months ago, he has hernia surgery, and he's having hypertension. He's having type 2 diabetes mellitus. So these are the comorbidities, but there is no family history of serious illness. Currently, he is on, of course, metformin for diabetes, sitagliptin for diabetes, enalapril and metoprolol for hypertension. And his vaccination schedule shows that he received booster vaccine 1 year ago, and he was having this pneumococcal polysaccharide vaccine also 4 years ago. And colonoscopy was also done 7 years ago, and he is a smoker. 20 pack year history is there, but he already quit 17 years ago. So he also drank alcohol, but that is okay, 2 to 3 alcoholic beverages on weekend, but he's allergic to amoxicillin. Now he's planning to move to southern areas like Australia and New Zealand. So what do you think? Okay, on examination, S4 is also there. So in this old patient, if everything is okay, then S4 is acceptable, right? So the remainder of the examination shows no abnormalities. Which of the following is the most appropriate recommendation at this time? So at this time, when he's planning to visit in southern areas, and the May month is already there, so what recommendations are you going to offer to this patient? Are you going to ask him for the low-dose CT scan of the chest, or you ask him to go for influenza vaccine, or pneumococcal conjugate vaccine, 13 valent, or DEXA scan, or abdominal ultrasound, colonoscopy, or cardiac stress test? So let's see what we are going to offer to this patient. So you can see here that this patient, if you can see here, the important thing is that the month is May, and he is planning to visit Australia and New Zealand. So keeping this thing in mind, this patient has a non-concerning S4 heart sound and seems to be in good health overall. There is only one concern in the southern hemisphere in May, that is winter is coming. So he has to go for influenza vaccination. But why we haven't chosen this one, low-dose CT scan of the chest? Because a low-dose CT scan of the chest may be used to screen for lung cancer. According to the US Preventive Service Task Force, an annual low-dose CT scan is recommended for individuals 55 to 80 years who have at least a 30-pack year smoking history. If you can see here, he's having 20-pack year smoking history. So he's, in this case, it's not recommended. Plus, whoever quit smoking in the past 15 years, so he already quit, like it's been 17 years. So both of the things, we can say that this patient has said that he's having 20-pack year history and he quit smoking for the past 17 years. Although this patient has 20-pack year smoking history and he quit 17 years ago, so a low-dose CT scan of the chest is unnecessary. We are not going to recommend this CT scan of the chest for now. Now, influenza vaccine, we definitely will ask for this because either live attenuated or inactivated is recommended every year during flu season from October to May in the Northern Hemisphere and May to October in the Southern Hemisphere. And the composition of each vaccine is adjusted for the hemisphere in which it is given, which may not always be antigenically and identical. Despite providing only partial immunity in these cases, the flu vaccine in the Northern Hemisphere typically provide protection against the main viruses that are circulating in other parts of the world, and therefore vaccination of the patient who have not received the influenza vaccine, because we don't know the status of a patient in this question, especially during the flu season, is recommended by CDC, ACIP, and WHO at least 2 weeks prior to travel. And he's already having, 2 weeks to celebrate his 25th wedding anniversary. So at this point of time, influenza vaccine is good to go. So when you click here, it will take you to the library and you can just have a read. Now, why we haven't asked this for pneumococcal conjugate vaccine 13? Because it's a polyvalent conjugated vaccine against 13 serotypes of Streptococcus pneumoniae, and this is the most common cause of pneumonia. Because it is a common cause of mortality in the elderly, PCV13 is recommended for adults 65 or more than 65 years of age. And in this question, the age of the patient is 62 years. So we are not going to offer this right now. For the DEXA scan, a dual energy X-ray absorptiometry scan may be performed to screen for osteoporosis. In patients with no other risk factors, a DEXA scan is recommended for women at 65 years of age. However, the USPSTF does not currently recommend screening for osteoporosis to prevent osteoporotic fractures in men. So there is no screening criteria in men especially. In addition, this patient does not have any other risk factor. For example, there is no use of corticosteroid, or there is no history of heavy drinking or previous history. For example, there is nothing related to bone fractures, falling minor trauma to suggest osteoporosis. So in this case, we are not going to offer DEXA scan because routinely it's not a screening test in men especially. We do recommend for women, especially at 65 years of age, but not in the case of men. Now, why we haven't chosen abdominal ultrasound? Because abdominal ultrasound we perform to screen for abdominal aortic aneurysm in men again 65 to 75 years, and he is now 62 years, so we can wait. Who are or were smokers? So, okay, he was a smoker, but age is the most important point because he's just now 62. He can have still 3 more years. Colonoscopy is used to diagnose and screen for colorectal cancer in a low-risk individual. A colonoscopy is recommended every 10 years starting at the age of 50 because this patient had his last colonoscopy 7 years ago and lacked symptoms suggestive of colorectal cancer. Already colonoscopy was done 7 years back and was normal. So it's okay, we still have 3 more years to go. And why we haven't chosen this cardiac stress test? Because the cardiac stress test measures how the patient's heart responds to physical stress in a controlled clinical environment. It is typically performed to evaluate blood pressure and heart rate while the patient exercises, usually on a treadmill. Although this patient presents with an S4 heart sound, it is a common finding among healthy individuals that are more than or up to 50 years of age. And furthermore, the patient has no angina and is not an active smoker, making a cardiac stress test unnecessary at this time because he has no active complaint like chest pain, or he's not an active smoker right now, so we're not going to perform cardiac stress test. So what is the main educational objective of this question is that if the age of the patient and what we are going to recommend at this particular time and what's the purpose of this question. Like here the main emphasis is the question is emphasizing us to the point that what we are going to recommend in a case when the patient is going somewhere to the southern areas. The month is very important, right, and the age is very important, and at this particular time period, at this particular age, what we're going to offer to our patient. So influenza vaccine every early, especially the typical seasons when we have to get this. Okay, so this is all about this. See you next session. Bye bye.